In July last year, David Cameron, our Prime Minister, made an announcement that all data in public services should be viewable by the public by the end of the year. And general practice was included in that. And so on the 7th of July, he said that data of clinical outcomes in GP practices in England should be published by December. So no pressure there. I was asked, the college, the RCGP, were asked to lead this piece of work, and I was asked to chair the delivery board, and that came to me in August, and we had till December to do the first phase of the work. The delivery board is a group of civil servants, data analysts and such like, who have been tasked with this job to make decisions. But it's been backed up by a technical group, and on that technical group I've asked for Helen Lester to come onto it and Martin Rowland. Because when I first took on this piece of work, there was nobody outside the Department of Health, and I really needed to be sure that the people doing the technical side of this work were competent to do the work. And so that's where we started from. And the aim of the project was to provide the public with a single source of comparable information. All the data which we delivered in December was already in the public domain, but you had to look for it in lots of different places. So it was a matter of bringing this together in one place and making sure it was accurate. We needed to engage with all the professional organisations, and that was no mean feat in the autumn, to try and engage the British Medical Association and all the sort of professional organisations so that they felt some ownership. We have an NHS Information Centre, which is the IT part of the Department of Health. And so we released our first phase of information on the 7th of December 2011. And so we met that target. And although we met the target, the data which we released was in a spreadsheet format. So it was completely unintelligible. But we needed to meet a deadline, and that's what we achieved. The second phase of the work, which is what I'll say a little bit more about in a moment or two, is to deliver an analytical tool. So something which actually works to compare practices and compare clinical outcomes. I apologise if you can't see all this, but perhaps we can print out some of these slides for you to have a look at. This was the first release of data, and these were the headings that we used. There are 134 quality and outcome framework indicators, which were already in this mix. There were 70 indicators from the National Patient Survey. And so we then included a few other pieces of information about secondary care, A&E attendances and the such like to include in this first phase of information. So there are 261 indicators which we released in December. We engaged with other organisations. There were places where, as I say, this information was already in the public domain, and it was just bringing it all together. So we have an organisation called Connecting for Health, which doesn't really do a lot of connecting because the IT systems in primary care don't really talk to each other, contrary to what you might have heard. But they don't work very well at the moment. But we have a summary care record in a fledgling form and electronic prescriptions in a fledgling form, as well as GP practices talking to GP practices, and a thing called Choose and Book, which is a mechanism by which patients can choose the hospital which they go to, and they can book an appointment that's convenient to them. Most patients would think there is neither choice nor bookability in the system. A lot of the data was held in the public health, and so there's a public health observatory site, and Health Protection Agency, and there's an Exeter system which holds list-size data of practices. So those were places which we looked at, and then we applied tests to all the data. So there's 6 tests which we asked of this data before we agreed for it to go into this mix. And the data had to be publicly available, first of all, and it had to be collected at national level, so all practice data needed to be there. And this is an England-only project. It doesn't include the other UK countries of Scotland, Wales and Northern Ireland, because this is a Department of Health initiative. Is the data recent? A lot of the data that's held is already out of date, so we excluded that. And were there any data quality issues? Is it relevant to primary care? And did it require any additional processing? So those were the tests we applied to the data. We engaged with organisations such as all the professional organisations and patient groups to make sure that everybody felt that they were involved in this process. And then we published the data on the NHS information site in December, as I say, in spreadsheet format, so nobody could understand it. The popular press didn't pick it up, which was great, because we had to do it so quickly. And it is just at practice level data. So we had 261, it says 260 on the slide, there's actually 261 items covering 8,300 practices in England. But this was the first phase. As I say, this is the first phase of a journey to provide more information. We've now got 25 more new indicators which are coming out any time now, which includes data on influenza, Choose and Book, and the electronic prescribing system. And the data which we released was structured in under 5 headings. So there's demographics, which is about about sort of age and gender distribution and practice list size. The patient experience, which is taken from the patient survey data. Quality and outcomes framework, as I say, there's 134 indicators there. Infrastructure, which is about the organisation of practices, how many GPs there are, numbers. And another heading on impact on NHS resources, which is about the use of mainly secondary care, referral data, hospital accident and emergency attendances. So the aim really is to enable people to start thinking about practices, thinking about the quality of the practices, and allow practices to compare themselves to each other. This is a busy slide. I don't expect you to read it, but it just shows how unintelligible the first set of data was, because that was the website which it all came out on, and you'll need to visit your opticians to read it. And this was the sort of next page of it, which is why nobody really picked it up. But there's all the sort of headings. All the data is there if you could find it. So our aim then is now to sort of produce a comparative tool, an analytical tool to allow practices to compare each other, to make choices, and to help our commissioning groups, which is the new organisations in primary care, clinical commissioning groups, which will purchase care from hospitals, but also need to ensure that the quality of care in the practices is up to a standard. And so the idea of the second phase is to promote improvement. It's a quality improvement tool to sort of drive up standards. And the next stage will be delivered in June. And if anybody does have 5 minutes, yesterday I managed to get hold of the sort of the play tool that we've got at the moment to show how this system will actually work, and it's easier to demonstrate it than it is to describe it. But we're having some new data items, but also developing composite indicators as well, so to try and get some idea of what it's like to be a patient in a practice. So we're starting with 3 composite indicators of diabetes, prescribing, and the patient experience. And our prescribing one is hopeful that we will release that in June. The diabetes one I'm sort of looking after, and we haven't got the first meeting for a while, so that's going to take a little while to sort out. And so it's designed that we will hopefully get an impression of merging indicators together, and I'm waiting for Helen to tell me that this is academically unsound, but it's useful. But it's useful to sort of combine the indicators together in a meaningful way that actually describes what it's like to be a diabetic in a practice rather than the sort of single indicators. So, several stages of work. The June thing is to produce the analytical tool, which I can demonstrate to anybody that's interested later. In September, we're going to build in some more functionality, which will allow you to export the data into other formats and do some real analysis with that. And then in the future, we want to be able to basically look at comorbidities and to try and again get a picture of what it's like to be a patient with several conditions and to try and do all sorts of analyses on this data. So that's the aim of the business at the moment. This was the view of the new system where you can drag bits and bobs across into here. So that you can then home down onto one individual practice or make several practices to compare with each other. We're going to stratify the data so that you'll be able to compare practices of similar list size, similar age distribution, and similar levels of deprivation to avoid comparisons of very different practices. And that again is the way of, you'll be able to drill down quite easily onto this. And as I say, it'll be a lot easier to demonstrate it rather than to describe it. But that's where we are at the moment. Early stages, but I think it's quite an exciting project. Thank you.